Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is the CEO of Arcadia, Michael Meucci. Michael, how are you?
Jared, thanks for having me today.
I'm pumped to have you here. I shaved my beard. I didn't want us to match too much, so I shaved my beard before the. No, I did shave.
That's a bold choice. I don't think I've been clean shaven in over a decade.
In Florida, though, with that humidity, sometimes you need to make the change for a few months until it gets cooler.
Yeah, I feel that. I just don't have the time in the mornings. Like this is very low maintenance.
Don't fool people. It takes a lot to keep that looking nice and trim. It can get crazy at times, right?
That's true. It can. It can.
Michael, super excited to have you here today. I always like to start out with, let's say there's a part of our audience that's never heard of what you're doing for whatever reason. Tell them what Arcadia does, and why you decided to start this company in the first place.
So from a big, hairy, audacious goal, we want to change healthcare with data. That's why we started the company 15 years ago. It was all about helping healthcare organizations take the vast silos of data that exist across the healthcare continuum, bring them together to have a single picture of every patient. Where are they receiving care? How are they receiving care? What care are they not receiving that they should be? Where are they receiving care that they don't need to be? And use that to optimize the way that we provide care. We've evolved that a little bit to say we want data to be a member of your workforce. And we'll talk about that as we think about AI, as data is a employee that doesn't get tired, it doesn't take breaks, it doesn't get sick. All data can get sick. And at a micro level, what we do is we build a bunch of interfaces and we hydrate big data lakes for some of the most advanced healthcare delivery systems and largest payers in the country. Folks like the Cleveland Clinic, folks like Rush Health, Ochsner Healthcare, Cigna, and Aetna. We spend a lot of time working with the organizations who are known for providing some of the most innovative care models and innovative payment models across the country.
Now, you mentioned data a few times in there, right? So what I want to focus on is because this is something that I feel like we've been talking about value-based care for many, many years, but it seems like as of the last two, the conversation has continued to maybe progress even at a faster pace. So I'd love to talk about the role of data in the future of value-based care. What does that look like through your lens?
It's a really good question. We have been talking about value-based care. I've been talking about value-based care for over a decade. I hot take, the question that is most often asked to me is value-based care dead? And that's very recent because there is so much stress on the healthcare economy from the healthcare economics side of that coin. And I would posit actually that value-based care is not dead. It's very much alive. We've jumped into a new evolution, whether it's like value-based care 3.0 or 4.0, whichever number you want to use. I think you're seeing people say we have to think about the cost of care and the economics of care very differently. And that is just value-based care. You now have organizations saying, yes, I may bill $2,000 for an ED encounter, but you now have them saying, what's the actual marginal cost of me delivering that service? And how do I need to account for the funds flow between the payer to my delivery system to make sure that I'm driving the appropriate operating margin on that event? And am I making sure that I'm maximizing operating margin and providing the patient the right services? That's just value-based care. I think what's in flux is the primary care attribution payment models, which were really prevalent in Medicare. Medicare is facing some big headwinds right now. There was news yesterday around star recuts, and that sent Humana stock into a nosedive. You have the news this week about CVS and Aetna and all the pressure on that organization because of the performance that the Aetna Medicare Advantage plan is seeing. And so I think that we're in a little bit of a reset moment as it relates to Medicare Advantage. It's not going away. More than 50% of retirees are choosing Medicare Advantage as their preferred plan. What I think you're also seeing, though, and I can wear two hats here, one as a vendor and one as an employer, is a demand by employers for the absolute crazy inflation of healthcare costs that are flowing through our P&L as employers and hurting our employees as benefits payers. We're looking for higher value in those relationships. And you're seeing a lot more discussion around how do you use the employed commercial populations as a place to experiment and enter into value-based models. So I think we're in a little bit of a evolutionary period. You were seeing heads of really key health systems, Rob Allen at Intermountain as an example. He's saying it's not about value or not value. It's about proactive whole person care. And that's exactly what the movement was started to do, is the right care at the right time in the right modality.
And to continue executing like you have been, you recently acquired a Care Journey. Can you talk a little bit about kind of what went into the thought process around that acquisition and how things are going?
Acquisition is great. We welcomed about 50 new Arcadians just over 90 days ago, and it's been a lot of fun. Care Journey was a longtime business partner of Arcadia's. The management teams are really close. And Anish Chopra, Care Journey's founder and president, and I were together about this time last year talking about how we can move faster together. And I kind of joked with them all, like, we can move faster together for one company because we'd remove the barriers of two different boards and two different management teams and two different operating plans. And 9 months later, we were one company, which was great. But the entire thesis around that acquisition and the coming together of Arcadia and Care Journey was about enabling the data you need to activate this new flavor of value. So your question that I kind of waxed on value-based care trends, I didn't answer the question about data because I knew you were going to ask about Care Journey. The data that we typically focused on as Arcadia was helping our customers bring together the various silos of data that they created. Care Journey, built in parallel to Arcadia, they said, we're going to care less about our customers' first-party data, and we're going to go grab a bunch of third-party data. Every Medicare claim, every state Medicaid claim, this cross-section of commercial claims, some social determinants data, some census data, and they're going to draw really broad outside-in insights about healthcare delivery organizations and payers to help them identify high-performing providers, high-efficiency providers, geographies with bigger health disparities needs than others, and use that to influence strategy and growth. And bringing together these two organizations allows us to smash together this third-party outside-in data with first-party data silos that Arcadia have put together. And we're the only platform in the space today that has that whole 360-degree view. And that's so important for this next wave of value, because no longer is it just about, hey, I want to make sure that all of my patients are getting annual wellness visits, or I want to reduce the cost of care of it. It's about making sure that if you are the Cleveland Clinic, you know exactly which providers in your community are delivering on your mission of being one of the most innovative and high quality providers, and which ones you need to go work with to get them up to that standard. And you also need to understand what are the cost trends. So as you're negotiating new payer contracts, you can understand the full texture of your performance to empower you to be the best fiduciary for the care that you're delivering.
Another thing I wanted to make sure we focused in on here today, Michael, was the promise of AI. So it's not a podcast, it's not a day if you don't hear AI at least once, right? That word, if it's not mentioned, something's off with the day. So
yeah,
you and I were chatting a little bit before the episode about this, but there's really very few scaled examples. So I would love to kind of hear how do we scale adoption of AI into a very defined timeline?
It's the right question to be asking. I think if you asked the question a year ago, the answer would be, I don't think we have enough demonstrated proof points that this is working the way we need it to. Today, we have proven in a number of pockets that chatbots or decision support co-pilots or ambient listening co-pilots or natural language analytics co-pilots are delivering on the value that we need them to. And we now need to take those examples and go all in on the deployment of AI. The last time healthcare had to drive broad technology adoption was the implementation of the EHR. And I think you'd be hard pressed to find anyone who would say that was a shining example of how to implement technology at scale across an industry. We have to learn from what didn't work with EHR and do it 10 times better, if not 100 times better with AI. My personal belief, and people will debate me on this, is that we need to start with non-clinical use cases because those are the ones that should have the lowest change management friction. If you look at the opportunity that exists in healthcare to implement and adopt AI, there is about $1 trillion of clinical and administrative waste that we all tolerate. We all pay for it, whether you are a employee paying for benefits as part of your employee plan, whether you're a taxpayer paying for Medicare and Medicaid taxes, we all pay for that waste. As leaders in healthcare, we have to be committed to attacking that $1 trillion of spend. Outside of the economics, we are also facing a tremendous shortage of employees in the healthcare sector, physicians, specialists, mid-levels. We know we're cruising towards a place where we don't have enough of the qualified healthcare workforce to support our growing population. And the only answer is unlocking productivity and reducing waste. And so when I talk to my customers, the guidance I give is staff the deployment of AI the way that you staffed the EHR deployment with change management specialists, monitor the adoption, build super users, and time box this. You're not going to have to deploy AI to every single team member, every single department, but pick one and say, in the next 6 months, we're going to take 3 or 4 workloads and drive adoption of AI to improve that. We did this at Arcadia a few years ago, or not a few years ago, last year. We implemented a co-pilot for our software engineers. And we said, we're going to offer this. We want you to use it. We cleared it with legal. We made sure that we had configured the co-pilot appropriately to support our engineers. And we wanted to make sure that as we were monitoring the productivity of our developers, we could look for those who were seeing a significant productivity boost from this, learn from them, quickly use those insights to then train the middle of the pack. And then for the folks that weren't seeing any productivity boost, figuring out, are they using it at all? What's the resistance and why? And then we use that as part of our training and hiring profile to look for individuals who have the aptitude to adopt and meaningfully use AI. We're now using it not only for our software engineers, we're using it in testing. We're using it to support our sales team and helping with content. Our marketing team, our internal IT team is using AI to modernize our knowledge management. And so as we think about how we're adopting, we've just set aggressive goals for the organization to have every employee using AI as part of their day-to-day workflow and providing both knowledge resources, but also monitoring resources to make sure that managers know where their teams are being effective. But we have to jump that chasm. We cannot let the deployment of AI be a decade-long project. It has to be faster because healthcare is at a breaking point.
Yeah, and I don't want to go to every single thing and talk about just the implementation over and over again at every event for the next 2 or 3 years, right? Like, you know how these conversations go, where the whole conversation is, here's the steps that we need to take to do the. At some point, with safety in mind, right? You do have to just, like, healthcare needs to kind of step out of that uncomfortable zone of taking forever to do certain things. And like you said, when it comes to waste and other factors, like, need to actually jump that chasm and move forward. So it'll be interesting to see what ends up happening.
And I think that on the safety side, that's why you start with administrative use cases. We as healthcare delivery leaders do deal with human life, and we have to be very careful with that. That's a privilege, and our communities rely on us to be responsible. But managing prior authorizations, benefit checks, network design, network modeling, all of that can be AI enabled, and that has very minimal impact on human outcomes.
What's next for Arcadia that you can share with us here today that you're really excited about?
After the acquisition of CareJourney, we have been feverishly building a number of new products, which we're really excited about. One of them is a contract intelligence tool powered by market insights. We have another network modeling application, which helps our customers build intelligent networks, all powered by AI. We're very excited about those launching. They're both launched in alpha today, which has been great. We have announced a number of very fun partnerships with leading HCIT vendors. So as you think about our direction, our mission continues to be to light up data as a member of your workforce, to partner with the best solutions in healthcare technology to make sure that our customers have a best of breed experience around our platform, and ultimately continue to focus on bringing together some of the best solution products in healthcare. We're likely to make another acquisition in the not so distant future, as we look to continue to add value in a marketplace that is ripe for disruption.
I love it. Michael, I hope to stay in touch and please keep us up to date on new updates. But really appreciate you joining us here on the podcast today, sharing more about the acquisition, what's happened since, and then talking some AI and data with us.
Thanks, Jared. I had a lot of fun. Talk to you soon.